So I'm so excited to talk to you because you've had a couple of things done with me that are designed to help improve sexual function. And I'll just say we're about the same age, so at this time in life, often sexual function is something that starts to decline. So first of all, you had a labiaplasty done with me, as well as a vaginoplasty, which is a tightening of the vagina. So I'll just share, I know that you'd seen another doctor about this and then you came to see me. Tell me a little bit about that process when you were thinking about getting it done, how you made that decision, and you know, what you were thinking about why you wanted to have this done.
Okay. I wanted to have it done because I've had 3 children and getting older, and I was just very self-conscious about my body, and which to me made sex uncomfortable, and sex didn't feel as good. I mean, that was, you know. So I started researching, and I looked at another doctor and even went to see the other doctor, and just kept on looking. I just didn't feel comfortable. I don't know, for some reason I just didn't feel comfortable, and I kept looking, and I found you and did some more research and realized how many procedures you had done in this, and being a female also was just kind of really the reason that I chose to come here, just because of all of your experience and all of the good things I read, and being a female.
Well, I'm so glad you did come, because we've been through this whole adventure together, and wasn't always easy, you know, recovering from the surgery, right? But now here we are. It's been quite a few months later. So let's talk about what it was like actually having the surgery done, because this is a real surgery. I mean, it's not all like fairies and unicorns, right?
This is not. This is a real surgery, and surgery center was very professional. Everybody was very nice, very professional, and you go in there and you get that little shot, and you don't remember anything after that.
You get that, it's called Versed, that nice happy juice.
That nice happy juice, and you don't remember anything after that. And then you wake up, and you've got one person sitting right there to take care of you and help you. And
now, just when you woke up, did you feel any pain?
No, you don't feel any pain. You can't feel anything.
Yeah, because you had that really strong local anesthetic block.
Yeah, that block, and you don't feel anything. And
when did it start hurting?
Just, you know, probably not until the next day, really. And it wasn't really even that painful. I would take, like, I was trying to just take Tylenol at first, but then after a little bit, I started taking the pain medication, but not as often as I had to take it.
So you were a bit heroic, but most people would need to take something pretty strong for a couple of days.
You need to take for a couple of days. And really the first week, I didn't feel like going anywhere. I didn't want to go anywhere, because you don't realize, but your whole world sits on
That's right.
Your whole world sits on that for the whole time, and getting up, sitting down, you don't want to go anywhere. And so that's it. And I have found, you know, everybody says, oh, put an ice pack. You know, well, ice packs are hard. And then it says, oh, we'll put some peas, frozen peas on there. Well, peas thaw out in 2 seconds. What you get is you get those frozen drinks, like daiquiris or margaritas that come in the package, the full package, and they're frozen. You freeze those up, and you put them in a Ziploc bag, and you put those on your bottom, and it is the most wonderful thing, because they're soft enough and they'll conform to
that's the best piece of advice.
It's wonderful.
Okay, so frozen daiquiris, ladies.
Frozen daiquiris,
for your postoperative
yes, for your
bottom.
postoperative, yes.
Perfect.
And then when you're done, when they thaw out a little bit, then you drink them.
Perfect.
You can drink them, and then just get another one.
Well, that's just a win-win, right? Especially when you're sitting around at home doing nothing. So it's really important to know a vaginoplasty in particular, because, you know, the labiaplasty by itself is a little bit quicker recovery, but a vaginoplasty, we're actually pulling muscles together, so we really need to honor that postoperative time. It is about a week where it hurts. It hurts quite a bit.
It does. It hurts quite a bit, and but it is worth it. Oh, it is wonderful. Yes.
So tell us about that. So another thing I know that you notice that all our patients do is you have this annoying discharge that goes on for a few weeks because the stitches are dissolving. So it's just painful, and then it goes into being annoying, right?
Right.
And then itchy and all of the things. And then finally, about 6 weeks later. Tell us about the first time you had sex. I think that's what everyone wants to know.
Well, okay, the first time I came for my 6 weeks checkup, got the green light, and everything was fine. And I don't, it was a little combination of both. I was a little bit apprehensive, you know, because you're kind of nervous because you've been, you know, operated on. I mean, that, you know, it's, and
That
you don't know
would-
you don't know what to expect.
Right, it
And-
would be scary.
Yeah, and so it's kind of scary, and it the first time was kind of painful because, again, you're nervous and you know everything combined, and it was kind of scary.
It's kind of like right after you have a baby, a lot of women have said. It's like you've got a
That's
pretty
it.
first scar. It's going to
That's
not
it.
feel good the first couple times.
Yeah,
And then when you got through that,
yeah, and then we got through that. It's great. I mean, wonderful. It's yeah, and I did this surgery for me. You know, some people say that they may do it for their spouse or their partner or whomever. I did it for me because I wanted to feel more comfortable in my body. I wanted to have better sex, and for me, I don't care about anybody else. I'm worried about me.
yeah, that's such an
And-
important point, I think.
Yeah.
You know, anyone who's had 3 kids, and I have 3 kids, our vagina is not going to be as tight as it used to be. And when we don't experience friction with vaginal intercourse, there's no question that we don't feel as much. So, you know, most men that I know are just lucky to be in the area. They don't really care. So we're not
Yeah.
doing it for them. But
No.
as a side effect, they do get more pleasure
Yeah.
as well. So that's
Yeah.
nice. But it's really important, I think, that you mentioned that this is really for us to feel better about ourselves. They can do their own things to feel better about themselves, but this
Right.
is for us.
Right.
So as far as your experience with intercourse, how has it changed it, just having that tightness restored?
Just like you said, the friction's better, just overall. And I think part of it again too is just my self-confidence is better. That in itself helps one, I think. But the feeling, you know, there's more feeling, there's more sensitivity and things like that, and it just is really, really nice.